Students, next class, last class we'll see about the exam. First, poliomyelitis. What is a poliomyelitis condition? Then we'll move to the assessment part. Then the treatment part is move to the early phase and residual phase. Then this class will move to the orthostatic prescription. What are the orthostatic prescriptions that we addressed for poliomyelitis cases? Before prescribing orthosis, it is necessary to assess strengthen the hip abductors and hip extensor muscle, then knee extensor muscles, then hip and knee ankle stability is maintained, then strengthen of the upper limb, then limb length measurement and gait pattern, then contractures and deformities. Then a child with foot drop can be given that is AFO, ankle foot orthosis. Then a child with weak knee may need a long leg brace with or without knee joint that lock straight for walking and bend for sitting. Then a child with weak trunk may require a long leg brace attached to body brace or to jacket, or also spinal brace also bring the spinal brace, then also attach a long knee brace. Then that is in this pictures is also called hip, knee, ankle, foot orthosis. The first one is ankle foot orthosis. Then common surgical procedures in the poliomyelitis cases: correction of soft tissue contractures, then correction and prevention of deformity by tendon transfer surgery, then correction of limb length inequality by lengthening or shortening of the limb, then tendon transfer operation, then upper limb, shoulder paralysis of the serratus anterior transfer to pectoralis minor to inferior angle of scapula, paralysis of delta transfer by trapezius to neck of humerus. Then elbow, paralysis of the flexors and strong flexor of the finger, forearm and middle condyle. So the humerus transfer to lower end of the humerus. Stendler flexoplasty, wrist and hand to improve the extension of the finger to wrist flexors or transfer to finger extensor. There is first one is a median nerve transfer, that is a muscle transfers. Lower limb, in case of the quadriceps paralysis, the hamstring muscles transferred to the patella. Then paralysis of the gluteus maximus and erectus spinae muscles transferred to the gated trochanter. Then PT management of the following tendon transfer operation: pre-operative management, that is due to weaker muscles to the joint get stiff the direction of the stronger muscle, so full range of motion is achieved by affected joint. Then the muscle is transplanted to will decrease the muscle by 1. So the muscle that has to transplanted to should strengthen by repeated isometrics. Then post-operative management: passive full range of motion progress to assisted range of motion, electrical stimulation. Then dynamic orthosis is given. Examination: Thomas test is positive, Q angle is decreased. Then polio vaccine is scheduled at both 6 weeks, 10 weeks, 14 weeks and a booster dose of the 18 months. That is in this diagram followed by the Thomas test. In this test is a Thomas test. Patient is the edge of the bed is lying. Then therapist is the front of the patient will move on the one affected leg is the downwards, unaffected leg is the pushed to trunk. So affected is also pushed back upward to the leg. So indicate the hip flexor muscle tightness. In this picture, ASA is the anterior iliac spine, the tibial tubercle, midpoint of patella. That is the midpoint of the ASA is to midpoint of patella, then tibial tubercle to other abdominal line. This angle is the Q angle. Okay, that is a Q angle. Mainly the poliomyelitis cases, the Q angle is reduced to the patient. Why it is reduced? Only the quadriceps muscle is the weaker. The quadriceps muscle weaker, so angulation is the reduced. So reduced angulation, so called the most of all poliomyelitis is common. Q angle is reduced. Then Q angle then is other more combination is the hip flexor muscles also tighten to the poliomyelitis patient. One is the hip flexor muscle tightness and quadriceps muscle also weakness. So the two group of muscles are commonly affected in the poliomyelitis cases. Okay, students, I will finish the poliomyelitis topic. Assessment part, management, PT management part, pre-operative and post-operative also. Then, thank you.